It's scary what's happening out there. 20-some-year-olds basically
No.
prescribing peptide to teenagers. This guy's telling a 14-year-old girl, hey, you should be losing some weight in your cheekbones.
Aurora Health Group, which focuses on peptides, HRT, stem cells, and really all things regenerative health.
Where do you see the biggest risk of unintended harm in the telehealth world?
Hey, what's up, everybody? My guest today is Dr. Sean Aurora. Now, not only is he one of the very few doctors licensed in all 50 states, funny enough, his sister being another, but he's truly a pioneer in the modern regenerative medicine space. Now, during the COVID era, he worked in the hospital system, but decided to really leave that after and go full force with his company, Aurora Health Group, which focuses on peptides, HRT, stem cells, and really all things regenerative health. Now, he's someone that I'm crowning, and he would hate me saying this, the prince of modern medicine. And he's really with his with his patient first approach to medicine. Now, Sean, welcome to the Compound Wisdom Podcast. Now, one of the first few things I want to talk about is really, how did you get into medicine? Like, what happened at a young age that you said, okay, this is what I want to do for the rest of my life?
Yeah, no, thank you for the introduction. Definitely not a prince, but I appreciate that. And yeah, really happy to be here, man. Excited to share this story with you. But yeah, not like, every other Indian, physician. My parents, pushed me or forced me into this, although they were definitely happy when I decided on this. But it was a choice of my own. And it really started with, my childhood trips out to India. Probably when I was, 4 or 5, started going there every summer, spending about 3 months up until I was about 17. So a lot of exposure to India, and the moment it really happened for me was, obviously was as I was a little bit older, but I wanted to go outside and play with a lot of the kids out there. And, there is a huge homeless population in India. I went running one day to play with them. My mom stopped me abruptly, grabbed my hand, and was like, no, you can't play with that kid. And I'm like, why? What's the matter? Why can't I go play with him? And, that kind of, started me asking more questions. She was like, oh, he's got a disease. He's got this, he's got that. And, obviously my mom's not a doctor. She doesn't, know anything, but it was this state of mind, I guess. And it was scary. And I started asking more questions, reading more as I grew. And, I really wanted to bring that positive change to those type of communities, right? Access to just healthcare in general. And that really got me exposed to medicine in a variety of different ways. And as I got older, and in my final few years of going to India every summer, my uncle and my grandpa both passed away with the stroke due to diabetes. Undiagnosed, not knowing what it was, not knowing how to treat it, not knowing what to eat. And that's scary, man. It wasn't like what we have now or what we have here in the States. So bringing that type of change, bringing that type of access to care was a big part of me being a physician.
That's awesome, man. And I know from firsthand experience, because, I used to live right next to your parents, of how proud they are of that. And, one thing I want you to touch on, even related to that, is your sister. I mean, she does the same exact thing as you do. So was that a similar experience for her as well?
Yeah, man. I tell you all the time, I joke around about it, but you put a wig on me, I'm on my sister. And, but definitely the same type of journey, the same type of passion that we have today was to make that positive change.
I love that. That's amazing. Now, one thing I want to ask about is, obviously you worked in the hospital system during COVID. Describe that first and foremost, and then, what made you want to eventually leave that and obviously, go full force with Aurora Health?
Yeah, yeah, absolutely. Got into the hospital system right out of residency. Prior to me even getting out, was licensed in about 10 states. So did a lot of bouncing around, and it was the COVID era. So it was the heart of it. It was 2020. It was, when COVID was at its peak, going from anywhere from El Paso, Texas to Billings, Montana. I mean, just bouncing around, helping where I could. I mean, this is why I got into medicine, right? Working day shifts to night shifts to swing shifts, flying the same day to work that night shift. I mean, it was a wild time. Did 70 some straight shifts at one point. But it was my passion, so that's what kind of was my motivator. What pushed me. Obviously, it took a toll on me, but I never got to the point where I was burned out, because again, I had that drive that I wanted to bring that positive change. And a year later, my sister joined me in doing the same thing in the hospitals. But while I didn't have that, burnout, I would say, from an emotional standpoint, really affected me, right? We're seeing the same patients come in and out of the hospital with the same chronic conditions. And I really question, I'm like, hey, what am I really doing here? Am I just, plugging a hole for that to be, dispersed again and then have the patient come back in and treat them with the same meds? Are we really making a difference in their overall longevity, wellness, well-being? And I don't think I was. And, in addition to me always, as my family grew and, I have a son now, I got married. I started thinking about other, ways I can bring, a positive difference in this space, which really drew me to telehealth and the wonderful things that we could do in that space. And I realized, we could provide so much access to medicine in the telehealth world. But what type of medicine is that? It's the preventative type. We can see those tangible differences that we're making as the years progress. And it was exciting to me. It was like, hey, this I could make a real change here, not see the same patient for the same chronic condition that's not really going to affect their long-term outcome. So it was a definitely the right move, and I'm very, happy that I was able to have that happen.
That's amazing. So you really went from what I call traditional medicine to, the medicine 2.0, as we call it. What are your thoughts around, the way healthcare is going? And one of the things you mentioned is preventative healthcare. Like, give your initial thoughts on it.
Yeah, yeah. So, I see you calling it medicine 2.0. We have, other docs calling it, the new age of medicine, other people saying, hey, this is whatever term you want to put to it, right? Whatever label you want to attach to it, but it's really just medicine, right? And we're just evolving as, as anything else. We're just kind of progressing, growing, learning more from each other. Now with, social media, we have different ways to network and learn from each other, which is it's exciting time, man. And I think we're just continuing to refine it, and make medicine better, more accessible. An important piece to all of this, though, is that preventative part. And a lot of these trigger words, a lot of these other words that you're hearing all the time, like longevity, regenerative health. And it's super cool, man. It's super cool what we're able to do now with this type of a platform that we have that we're building. And we're not seeing those normal, normal patients come in anymore where they don't, they're being treated for the same chronic illnesses and they have those 5-minute conversations with the doc and the same meds get sent out to them, but we're not making that tangible difference. So now we can really focus on some of the foundational pieces, that can really make that positive impact in the patient's life. When I talk about foundational pieces, I'm talking about hormone replacement therapy, regenerative health, peptides, right? The new GLPs. It's an exciting time, but there's so many other therapies that we have now, access to as providers, and now as and even for patients. It's truly game changing, man. It's I think we're gonna make a big difference, and we're gonna see those differences in the next few years to 10 years to 30 years, 50 years, and it's gonna be really exciting to see how much of a change that's happened. I think I mentioned this to you once as well. Is like we're gonna be seeing this really happen where my kid, my 2.5-year-old right now is going to be able to get the positive benefits of all these changes that we're making now, in this space. So yeah, truly exciting time. And again, it's just medicine at the end of the day, but it's just evolving.
The evolution of medicine. I love that.
Mhm.
Now, there's obviously a ton of skeptics out there. When you start talking about HRT and GLPs and Ozempic and all these different things, peptides. What are some words that you have for a lot of these skeptics, and then also for people wanting to learn about these things? What are some first initial things that you would tell them?
Yeah, this is where I really wanted to get real with you is when we say skeptics, these skeptics are within our own communities, right? These are actual physicians that are skeptics. These are specialists, those that have spent a very long time going to school, different fellowships, and very smart individuals. They can be these skeptics. But it's hard. It's like an ongoing battle really with them where we have one side where like, oh, unless we have these, multiple clinical trials, unless we have all these studies backing it up, it's not safe to provide this type of care to patients via telehealth. But and then it always comes down to like who should be providing the type of care, what type of physician should be providing that type of care. But it's there's so many of those kind of questions, and we're really trying to bring that positive change in this space. Where in my head is like, hey, we're providing access to these wonderful therapies that first were very hard to get. These same therapies also, yeah, some of them may not have the years of science behind them, the clinical trials that have been published in human cases yet. But that's fine. The other medications that have been essentially, ran through trials, have gone through these phase 3 trials or with big pharmaceutical companies. At one point, they were being studied, right, on patients, and they were making a positive change, and they weren't FDA approved at one point.
Yeah.
So it just, there's so much that we can get down into when we're having that conversation. I think we need to have like a whole other sort of
Yeah.
I feel very passionate about it, but it's
Yeah.
it upsets me at sometimes, listening to a lot of these specialists really just get really, buckle down and, against what we're trying to do here. They're not understanding like, hey, we're getting so much care now to these patients that they first didn't have. And we could
Yeah.
be preventing a lot of these long term illnesses that I was seeing in the hospital again and again. And that's, what I'm seeing happen right now. And it's what can we do on our part, right, to show that, hey, we are making this different. And I do like the idea of, independent research studies on the type of setup that we have as an organization right now. I
Yeah.
think that could be a positive thing, right? We can show the differences that we're making. We can, we have obviously very rigorous sort of programs, right? So intake forms, follow-up forms, a direct type of oversight protocols. So we do add all these layers of safety. Um,
Yeah.
and so it'll be interesting to see where these skeptics lie with what we're trying to do in the next few months, a few years. But I think social media is definitely going to help with that, with more of us engaging with each other and learning from each other. What's the other person doing?
Yeah. And you mentioned a few things that are very, very key to what you're doing with medical oversight. Talk about kind of the realm of what's out there right now from, doing there's like art access for everybody through social media that it can be detrimental for like, for example, research peptides to really what you're doing in like your doctor first, doctor supervised approach.
Yeah, no, great question. It's scary what's happening out there. I say access is great, right? But on the other side, it's very scary also. The other day I
Yeah.
was in TikTok, and it's I like TikTok, right? But I was watching this 20-year-old something talk about looks maxing, and it's funny. I was talking with my director of marketing, Lindsay Abyss,
Yeah.
and our team, and I don't know if you've heard of it, what looks maxing
Yeah.
is, but dude, it's these 20-some-year-olds like basically,
No.
yeah, prescribing medications like peptides and or giving recommendations on, like, for example, aesthetic treatments like Accutane to 18 some 16-year-olds, 15-year-olds. It's so scary on social media. And I saw this 20-year-old
Yeah.
basically, I mean, if you listen to him talk, if he was, looked a little bit older, I would think he would be a physician, right? But he's using a lot of these words that he probably learned on, Google or ChatGPT, and describing
Yeah.
these. So he's speaking to females, these young, teenagers, and it's just so sad, man. It's so sad to see that because, he's like, hey, you should be on Retta. And the way that he's using it, it's like he's trying to make it a fad, right? Like, oh, you should be on Retta, but we're talking about actual medication here. We're not just talking about
Yeah.
something that, everybody should be just taking to, like go from like 8% body fat to like 4% so they can get shredded. That's not how this would be done. It's scary, and social media is making it seem that way. So access is absolutely great, but it's the right type of access, right? So
Yeah.
being that change is what we need in this space. Is let's get more access, but also it has to come with that physician oversight or provider oversight, right? Building a team that truly guides how these medications are provided in the telehealth space. So that medical directorship program, which is what we have, is where we lead a group of providers providing these type of care, but with the right type of oversight, initial forms, follow-up forms, the right types of pharmacies that we use, the right type of sourcing for these meds. the right type of ongoing support that these patients need, and also letting them know, hey, this is not just about the medication itself. It's
Yeah.
about everything that goes along with it, right? There's a mental health, there's a behavioral health component along with it as well. When this guy's telling a 14-year-old girl, 15-year-old girl, hey, you should be working on, losing some weight in your cheekbones, or your maxilla area. It's so scary to me. I'm like, how are they going to grow thinking like, that they should always be at like a 2% body fat or a size 0 while growing up. It needs to be done the right way. And so the type of programs that we like to collaborate with, the organizations that we like to collaborate with, and digital health clients or med spas and wellness industries, we like to work together on making sure that it's a program based approach. So it's not just the medication alone, but it's everything that goes along with it. So the behavioral health thing, the nutrition thing, the exercise. So there's like different things that we input in our protocols to make sure every patient that we're overseeing does it the right way. And that's when we're going to notice that, hey, we're going to really make a positive change here, because we're doing this right. We're not just pushing a button.
Yeah, I mean the data over time is the clinical study, right? So yeah, that's amazing. Sean, let's talk about HRT. And I know you have a big, massive push that you want to do into it. What's inspiring that for you? I also want you to touch on like what's out in the market and what's different that you're trying to do as well.
Yeah, absolutely. So with HRT, I think, excuse my language, but everybody and their mama is trying to get into this, right? It's
Yeah.
it's a new thing. It's where everyone's trying to make it feel like it's a new thing, right? But at the end of the day, this is the foundation. It's a building block, right? Of for every patient that we see. So it
Yeah.
needs to be handled delicately, and we need to also handle it the right way, especially with what's happening now in women's health, where recently, we heard the FDA remove the black box warning, which is absolutely great. A great news, should have happened, many years ago. But hey, it's happening now. But now we're going to see tons and tons of groups, money focused, get into this space, trying to make a good buck, and try to
Yeah.
get HRT out there. But what we want to make sure is that we're doing this right. There are a couple organizations, great telehealth companies, that are doing this right, and they've been doing this right for some time now. Which it's so nice to see, but really modeling that and really making sure that every patient does have access to HRT, but also in the right way. So the way that we do things is we have our advisory roles, board members, different specialties that are doing different things in the space. And we come together to continue to refine our protocols. So every patient with HRT does have, their own customized type of setup with us. Definitely have their own, type of intake forms and follow forms that we follow to make sure that they're progressing well too.
Yeah.
Not every HRT patient's the same, male or female, right? And they're very different. I'm very happy that we're going to be able to bring that change in the space where we can provide really good access to these therapies. But
Yeah.
yeah, we have to do it right. We have to keep that in mind. So HRT is going to blow up, and I'm a little scared, a little afraid for what might happen.
Yeah.
I encourage every patient that's seeking HRT therapy to make sure that they do their due diligence, make sure they get educated on prior to signing up with a digital health platform.
Yeah, and I think, one of the things that I love about what you're doing is all patients have a direct line to, the doctor's network always, right? And not only that, it's not like one doctor is like on polar opposite sides of what they think HRT is. It's everyone is in sync on their beliefs, which obviously comes from you, which is amazing. Now,
Yeah.
with HRT, let's kind of touch on a few different like subtopics within it. And I want you to talk about the differences of HRT for men, which I think is a lot more simple than it is for women. And then you want to do a big push into women's health, like you mentioned as well. And then the next question simultaneously is like, what age do you think is a good age for people to start looking into HRT if you were to put a number on it?
Hmm.
And I asked the same question to Dr. James Lavelle as well. So I'm curious to hear your opinion.
Yeah, it's again with HRT, very customized, personalized thing. We have our protocols that we continue to refine. I also feel like while we have our medical insight, our medical provider oversight as well on these digital health clients, every digital health client also is different.
Right.
We only like to partner with those that do put the patient forward. So patient centered, patient focused organizations. But I do see that protocol, it's not a cookie cutter thing, right? Everything is very customized, everything is very personalized. So it really does matter on the patient that we're seeing. And we'll do we'll do what we can in our scope. If we ever felt like, hey, for example, the person came to me where I felt like, hey, they're 15, they're 14, they're super young. I do feel like they need HRT, but if that doesn't fall in our scope, for example, our current provider group, we won't provide care for that young, the pediatric population. We're not going
Yeah.
to do that, but there definitely might be a need for it. So we'll
Yeah.
provide referrals like, hey, you have to go seek help. I do think you could benefit from it, but again, I can't speak on it entirely via telehealth. I do feel like in this case, you might need some further workup, and we will
Yeah.
refer them. So that's also very important. I feel like a lot of companies are it's hard for them to say that because they would rather just take in more revenue, which is scary to me,
Yeah.
like I mentioned earlier. So it's important to really customize, personalize, listen to everybody. But then if you can't do this within your scope, make sure you refer out, make sure that they have at least a resource that they could go to. While the access may not be with us directly, at least let's provide them access or help them with access somewhere else. And the other thing that you mentioned was male and female health. Yeah, very, very different when it comes to HRT. It's what's happening now also that we see a lot are, just bodybuilders trying to get jacked, trying to get
Yeah.
HRT. They really
Yeah.
don't have any other reason for it, medically speaking, right? And that's not what we do. We don't support that. We don't, back those guys up. We want to, HRT is the foundation. It's a building block, like I mentioned, but we want to make sure that it gets in the right hands, right? The right people are using it and they're using it for the right reasons, and we're making a positive impact in their life, not just so they can bench 400 the next week, right? So it's what's happening though. But and then with in the female population, it requires even more attention. It requires more oversight, longer visits, and that's important, right? We really have to figure out what's going on here for
Yeah.
us to make the most informed decision.
I love that. For the audience, what are some symptoms or things that they should be looking out for that you would say is like, hey, you should probably look into HRT or talk to a doctor about it?
Absolutely, man. Good question. So I think fatigue is probably the one that I see most common, right?
Yeah.
As a 30-year-old, 40-year-old, I mean, you shouldn't be that tired all the time, every single day. Don't just blame, your work life or, having kids, for example.
Yeah.
There's other reasons for it, right? Let's find out what's going on. And like I said, man, it is the foundation. Let's see what's going on. Go at least get some blood work, get a
Yeah.
better idea of what's happening, and let's start there. Let's
Yeah.
really check your testosterone. Let's check some other markers as well to make sure if it's not testosterone, it's not hormones that we're worried about. Maybe it's something else, right? So I do like the idea of really pushing now the idea of labs. And I think that
Yeah.
way we can make the best decision possible. Just
Yeah.
having, an intake form filled out and let's say five markers are like sleep issues, like weak, tired, low, sexual arousal, like those kind of things alone will not justify us starting a patient on HRT, right?
Yeah.
You definitely need the lab work for it, and it'll give us the most informed decision.
Yeah. Lab work is, something that I know you've shifted your mindset a lot on how,
Yep.
and I asked again, Dr. Lavelle this because he's very, very big on it. How often do you think someone should get their lab work done and why?
Yeah. Yeah, no, that's a great question, and that varies, right? Also, a very personalized, customized type thing. Some people might need it once a year. Some might need it.
Yeah.
A younger population might not need it once a year. But now what I'm seeing is, in order for us to pursue this world of longevity and wellness, you see these words like biohacking all the time to be our best selves and to truly optimize ourselves. I like increasing the frequency of labs, right? I'm all for it. Let's test these different markers out.
Yeah.
Obviously, there's going to be some naysayers like, oh, you might find something low and that you would have never tested for ever, and you might go down a rabbit hole, and that might lead to more expense and cost and unnecessary burden for the patient. But I'm seeing more of the other side, right? I'm seeing that we're able to find things that we just didn't know were wrong with us, and we could be changing lives here with the type of therapies that we offer. So I encourage everyone to at least get initial set of labs if they've never done it before. I definitely recommend. There's so many sources now that do it. Obviously, we're building that in our own platform and encouraging our clients as well to really push the idea of labs. And there's so many different types of panels you can get now that we've created as well. Whether it's the metabolic optimization panel, the peptide readiness panel, HRT panels, weight loss panels. I mean, panels for different things, right? To really find out what's going on with the patient.
Yeah, absolutely. That's something I've actually personally have done for since I was in my 20s. I don't know why, thinking back on it,
Wow,
and I'm glad
really?
I did
Yeah.
study it over
Yeah.
time. Now, one of the things I want to discuss is a very hot topic is peptides, right? And GLPs. Why do you think there's so much stigma around GLPs, number one, and Ozempic and, all these different things? And what are some peptides that you really recommend people look into if they're just starting out?
Yeah, no, great, man. It's going to be hard to just recommend peptides by name. I like to see though is I like to speak to a patient. I always mention the way that we do things as a provider group is
Yeah,
to really make a personalized, customized experience. Right? We have a thorough longevity type of intake form that we ask everybody, especially when starting peptides, and we'll see if they even qualify. Right? Some patients don't qualify for peptides. They don't need peptides. There's no reason to take peptides if you don't have a reason for it.
yeah,
Which is what the issue is, right? With the social media and like just shooting out names like Reddit. Well, I want to be on Reddit just for fun. I want to have a
yeah,
sex, so I want Reddit. Those are not justified reasons to be Reddit, right?
yeah,
To have like larger, shoulders or biceps or traps. So I'm gonna get on like CJC, Ipamorelin or Tesamorelin, some of these growth hormone peptides. That's not the right reason to be on peptides. So the way we like to do it is like, hey, do you have symptoms that you have been dealing with? Any life altering symptoms, right? Then you could come into the digital health platform. We can educate you about different types of peptides, and then fill up the form, see if you qualify. Are there any reasons for us not to start a patient on a peptide?
yeah,
And we'll review that right with the provider group, and then we can make that informed decision. Like, okay, based on what you've told me, based on all these absolute contraindications, relative contraindications, from a medical stance, I think you would most benefit from X, Y, and Z, right? So it's not like if I have an injury, I need BPC 157, right? Have you tried anything else? Like, have you tried some of the first line, second line, third line therapies? You don't have to jump straight to peptide, right? That's not really how it works.
yeah,
And I want to make sure that we kind of take that away from the mindset as well. It's not like a first line therapy for everything, right?
yeah,
It depends on the patient and what the needs are.
yeah. I love that. Let's actually
Mhm.
talk about, you mentioned obviously forms for the audience. What do you mean by that? Like, forms itself. And why don't we walk through like the funnel of what it looks like, for someone to go through to go through like a telehealth experience as a patient?
Yeah, absolutely. That's a good question too. When a patient does come into any digital health platform, right, one that we are overseeing or whether it's just any other one, it's important to see what type of content that they're putting
Hmm.
on their website. Is this educational content more so like, hey, they really do want to teach you, they really want to be that change in the space where and they're not just trying to sell you on a product where they're guaranteeing certain things, which I'm seeing a lot, right? Which are just marketing tactics.
Yeah,
And I hate that, right? I really like digital health platforms that have so much education there that I can learn anything I want to by just looking at a few pages on their website. Rather than, companies that are there saying, okay, you want to get big, you want to get jacked, get, HRT, we'll show you how to get it, right?
yeah,
And it's very easy. I don't like that at all. And there's tons and tons. The majority of websites I feel like are like that,
yeah,
telehealth platforms. So we definitely want to see that shift away from that. So once a patient does find that educational material, they feel comfortable with what's provided there. Make sure when you do go through the process, the consultation process, your intake form is not a 2-minute intake form. I
yeah,
like that idea, like to stay efficient, but 2 minutes, you're not going to be able to provide that much information on there that's needed for a provider to make an intelligent decision here for your care. So all you do there is risk having some sort of medication prescribed to you that you really don't need, and that could result in some sort of adverse effect. So what you want to do is make sure that this intake form is asking the right types of questions, right? Asking the type of symptoms that you're having. Make sure that it's asking some stuff about your past medical history, so it offers those disqualifying factors so you don't get a therapy as well. Once you've completed that intake form, make sure there's some communication line with the provider, right? Whether it's an audio call, a video call, or just a chat line that you have direct contact with the provider. We're seeing AI, go booming right now, but what's that doing is like, hey, are we not talking to a doctor anymore? Is this all
yeah,
automated? I mean,
yeah,
there's ways that you can automate things, which I like, But then at the end of the day, there needs to be some communication with the provider, right? An MP, a PA, an MD, a DO. Like we need to
Yeah.
talk to somebody that's a provider that's going to be clearing for the medication that was approved via the intake form.
You brought up actually a really, really important topic is AI. If I'm a patient, why would I want to go talk to the doctor, especially if I'm getting into these things versus AI and where it's at now? And then, over time, what's going to happen with AI, in the medical field as well, in your eyes?
Yeah. So love AI. Don't get me wrong. I love AI. I think it's absolutely great. It
Yeah.
will expand access to the type of care that we're providing. We're already doing that with telehealth in itself. And now we're adding this tool, which is AI, and it's going to expand access even more. But the key word there is it's a tool, right? It's a
Yeah.
tool providers can use, digital health clients can use, and med spas can use, right? To streamline workflows, get more efficient. But at the end of the day, it still needs that physician to review. It can't be done without that doctor's group right now or the provider group right now. I still feel like that's key to really providing the type of healthcare every patient needs. It'll definitely help with workflows and efficiencies, though. I'm already seeing it right now. We're implementing it all the time.
Yeah.
Under the next little layer of AI that we would love to use is our full, end-to-end solution, providing feedback in real time for a patient wearing a wearable device, for example, like an Aura or Whoop or whatever. It'll provide that feedback like, hey, these are some recommendations based on your doctor's protocols. But at the end of the day, that recommendation can be made and it still needs to be cleared by a physician's group or provider group.
Yeah. How far do you think it is in terms of technology and AI where AI itself will be able to prescribe and do you ever think that's a possibility where it doesn't? But how far away do you think that is from your professional experience?
I mean, legally, very far. I don't
Yeah.
think the legal system has caught up at all to medicine and the way that it's evolving,
Yeah.
which stinks. There's so much that can be done, but again, we also have our legal guardrails for what
Sure.
we can do and what we can't do. Right now, I don't think it's possible for AI to be a prescribing tool,
Yeah.
where it'll just eliminate the provider group entirely.
Yeah.
One day it might happen, right? With if it's built the right way. Again, I'm not very much of the tech guy, right? And into how all these things happen, but
Yeah.
I think we're still far from that, but more so because of the legal stuff.
Absolutely. Absolutely. Even touching on the legal side, let's talk about, where do you think healthcare is going to be in the next 2 to 3 years with regulation and really regulation around a lot of these different things that we discussed, peptides and HRT, some of the changes that you mentioned earlier. Where do you think healthcare is going to be in the next couple of years?
From what I'm hearing with, our current administration is good stuff, right? I feel like they have a better understanding of what, peptides can do, regenerative health can do, and hopefully we see those changes being made here
Yeah.
in the next few years. I'm all for it. I really do hope that does happen. Because what we do see is we do have certain limitations in the telehealth space specifically, or even in the med spa wellness space specifically, because of these guardrails.
Yeah.
While I like the idea of being compliant, and as an organization, I always love to strive to be like that 110% compliance. But when you hit 130, 150 of like, you hamstring yourself, right?
Yeah.
It prevents you from providing the right type of care. And who gets hurt at the end of the day? It's the patient.
Yeah. Absolutely. Now, taking a step back towards the end of this, what are a couple pieces of advice that you would give a patient that's eh, relating to healthcare at all, that's wanting to get into this stuff? I think I maybe asked that earlier, but what are some pieces of advice like, hey, I want to look into peptides, I want to look into HRT. What are some advice you would give them?
No, absolutely. For patients, again, finding that trusted source, right? Finding that trusted digital health platform, wellness spa, med spa, a provider group, a physician. I mean, even if you're going to your PCP, whoever you're going to, making sure that you can trust that individual, that they
Yeah.
have you in mind and they're putting you forward, right? So
Yeah.
everything designed by the company. And I always go back to the protocols. It's not just a piece of paper that tells you what dose a person should get, right? It goes to how like it's an SOP, right? It's like how a patient should be treated from start to finish, right? That end to end solution. So I encourage patients to make sure that they ask a lot of questions before they engage with the group, right? Make sure that they're going to get that type of care. Don't just base it off of what you see.
Yeah.
Make sure you be aggressive, be proactive in asking a lot of questions. Sometimes, patients don't know what type of questions to ask. So really, one question I'd recommend asking is like, what is my end-to-end experience, and what does it look like not just for this visit, but what does it look like for the whole year?
Yeah. That's awesome. It's a great, great point.
Mm,
Now, Sean, how we typically like to end this podcast is really having you ask a blind question for the next person that's going to be on the Compound Wisdom podcast.
mm.
But before we do that, I'm actually going to ask you a question that the previous person has for you. And the previous person is Dr. James Lavelle, who obviously
Oh
you know
boy.
very well.
Oh,
So,
really?
yeah. So his question is, what's one belief about health or aging that you were really certain was true, but that you now think was completely wrong? And what forced you to change your mind?
hmm I would say technology, right? For me, the only way to get, proper care, lab orders, medication orders, a diagnosis, what's going on with me was physically going to an office, getting treated by a doctor, having them talk for me for 10 minutes, right? I thought that was the only way medicine existed, right? Or, getting sick and going to the hospital and getting treated. But now
Yeah.
it's this whole new world, man. It's so exciting with what we can do with telehealth and access to so many different types of therapies where I can feel comfortable. Like I'm like, hey, if I want to live 5 years longer and
Yeah.
be healthier when I'm having my third, fourth, fifth kid, I'm not, but let's say I was, and I want to still
Yeah.
be playing with them. There are
Yeah.
ways I can do that. I can make adjustments now, and I could do that at home. Like, on a laptop, I can speak to someone, I can see someone, I can discuss this with an organization, and I can make those changes now to prevent me from, feeling super old in the future. I didn't think that was possible, but
Yeah.
it's happening, and we're doing it. We're
How
hard. Yeah,
it's happening
very
as well,
excited.
right? Yeah, it's amazing to say the least. What's your question for the next person?
Um, I think, yeah, I think I'm gonna go back to just a little bit what we were speaking about from the legal side.
Mhm.
But there's also other types of risks involved, right, in this space, and we mentioned a few of them already in the telehealth space. So,
Yeah.
what my question would be is where do you see the biggest risk of unintended harm, right, in the telehealth world? So, is it ethical? Is it regulatory? Is it like health equity or clinical quality, right?
Yeah.
Where are we seeing the biggest risk right now? And
Yeah.
I'm curious to hear other people's thoughts.
Okay. The next guest actually, that's a great, great question for him. So
Yeah. Yeah.
brilliant.
You're not gonna tell me who it is, huh?
I can't, man. It's part of the game. You're gonna have to listen
Okay,
to the next one.
probably.
I will say he is I'll just say the word sleep. That's all you'll get from me. So
Okay, I like
yeah,
it.
awesome. Well, that was amazing. Thank you again for your time, man. That was amazing, amazing to hear from you, to say the
No, I
least.
really appreciate what you're doing, man. This type of stuff, man. This is what needs to get out there, right? And this is how we educate.
Absolutely. All right,
Yeah.
guys. Thank you.
Thank you, Steve.